This has definitely been an unexpected year, but the mission of the ACCMA is to provide a forum to bring our doctors together, to collaborate to improve the profession of medicine and to improve patient care. It's not the year any of us expected, but we have accomplished a lot, and we're really excited to celebrate some of the things we've done together this year.
Now to the scene unfolding in California at this hour. That ship on board of the 46 tested, at least 21 people testing positive.
You're wondering, what is this here in my county? And, of course, it's on the news. You have all of this, rhetoric that's going on about, and these people can't leave the boat. What are we going to do about these cruise ships? And so I started the COVID task force, and we called it my kitchen cabinet. I had a COVID czar, okay? Dr. Terry Hill was our medical director for our COVID response.
There was a recognition early on that this was an existential threat to the community, and the physicians rallied both out in the community. People did what they needed to do. There was a steep learning curve, and a very large number of people worked 7 days a week for months.
It became very clear that what we needed was to put on an educational series virtually, of course, for all of those clinicians as to how can I quickly, for very low cost, get up and running with my practice to see all my patients in a telemedicine scenario.
One of the big challenges that really took us almost till the end of July was being able to get enough PPE, especially for the solo and small practices, because their whole supply chains had been disrupted.
The CMA and ACCMA arranged for donations of PPE, masks, face shields, plastic robes or gowns. Staff was thrilled. Now they had N95 masks to wear, hand sanitizer, things that we were really scrambling to try to find. You can think of it as life-saving because it kept my staff safe and it kept my patients safe.
Unfortunately, politics began to rear its head as the months went on, and we learned that our local public health officers, like so many around the state, were actually being bullied and harassed by people who disagreed with their decisions and who really disagreed with the science. So we submitted a op-ed, again in collaboration with one of our neighboring Bay Area medical societies, to defend our public health officers, to commend them. We have really embraced science here, and the consequence is that we have a lower COVID rate, and our health system is not overwhelmed, and we're in relatively good shape as we enter the winter months.
Physician wellness was a concern, and it continues to be a concern, and an area of focus even before the pandemic, but certainly during the pandemic it became even more of a challenge and an issue for docs as they face this new stress of the pandemic.
Given that physician burnout is a big issue facing physicians in our community, ACCMA came up with confidential group therapy sessions via Zoom that were totally paid for by ACCMA. I'm so proud of that achievement. We were able to harness so many wonderful talents in the community within the Alameda and Contra Costa counties.
We were also worried about keeping our programs and services on track. And one thing that we've been very proud of is the ACCMA leadership program that we've built over the last few years. Fortunately, we were able to pivot and offer that program as an entirely virtual program, preserving the core faculty, including Dr. Hillary Worthen, our course director, and incorporating a lot of the engaging and interactive features of that program that have really been what has made it stand out. So we're really proud to have kept that program going.
Let me tell you, that was some year. 2020 is still waiting. I can't imagine what else could happen. I've got exactly one more week in my office from that year, and I had no idea what 2020 would be, and it's been a wild ride the whole time. And even though we rode out, I feel like now it's like we're surfing in, coming in the shore, and we have learned a lot. And I know that this pandemic is not over, but I feel that we've developed the tools and enough of the knowledge that we can continue on and save lives and keep physicians' practices going.
Thank you very much, Katrina, for a wonderful job that you've done in a very difficult year.
Dr. Peters, thank you so much for your tremendous leadership during your year as president.
Thank you so much, Dr. Peters. We really appreciate everything you've done for the organization.
Thank you, Dr. Peters.
Thank you, Dr. Peters.
I want to personally thank Dr. Katrina Peters for leading our group through this very challenging year.
I want to thank you for your energy, your leadership through this very unusual year.
Having you and your presence has been calming for everyone, and I think it's just been absolutely fabulous.
A warm and heartfelt thanks for Dr. Peters.
Thank you, Dr. Peters, for your leadership during an unforgettable 2020. It is greatly appreciated.
Thank you, Dr. Peters, for your excellent leadership at ACCMA amid the COVID pandemic. You're an example to be emulated. Thank you, Dr. Peters.
You have handled the ups and downs of ACCMA's path through this pandemic with grace, aplomb, resilience, and you've been a great motivating force for all of us.
I can't think of anyone better suited to lead the ACCMA through a worldwide pandemic, the moral and social reckoning embodied in George Floyd and Breonna Taylor, not to mention wildfires and bad air, all in the midst of the most sustained political circus in U.S. history. So the next time we face multiple, simultaneous, apocalyptic crises, I certainly hope that we can count on you again. Thank you, Dr. Peters.